Good evening, party. Good evening, participants and delegates. Thank you for joining Shield Connect today. So today we have a special guest, Dr. Umaya S. Dar Uday, and the topic for the day is the basics of obstetric Doppler and how to optimize it. And this is the series arranged by Dr. Ritu. So the web series is Icons in Conversation with Dr. Ritu, and today icon is Dr. Umaya. So further, I hand over the session to Dr. Ritu. Let me give a little idea about our page Shield Connect. So let me share my screen. 1 minute. So this is our page shieldconnect.in, where you can find various sections are available. And first section is the blog section, where you can find various blogs written by the eminent speakers and doctors. The second section is the webinar section, where you can find various gynecological and obstetric topics. And the third is the awareness page, like we have PCOS awareness page, menopause awareness page, immune booster, and COVID-19 page. So you can go through it. Then we have a special day page also, like GDM special day. So you can find all the videos related to GDM. So without wasting time, let me give introduction of our moderator. So Dr. Ritu Sanwani, ma'am is MBBS MD, done ERTE from NUHS Singapore. Dr. Ritu Sanwani has 20 plus years of experience in obstetric and gynecology with specialization in cosmetology and IVF. Ma'am is sharing knowledge and doing welfare activities, and she is also host and keynote speaker of more than 1,000 plus webinars. And ma'am is currently director of Pune Test Tube Baby Center and Chambal Women Clinic. So ma'am, I welcome you, and you can start this session.
Yeah. Please introduce our speaker also, Dr. Nishant.
Okay, ma'am. So I will introduce.
Yeah.
So I also welcome our icon of the day, Dr. Umaya S. Dar Uday. Ma'am is MBBS, Master in Obstetric and Gynecology. Ma'am has done fellowship in MFM. Dr. Dar Uday has been working as a consultant in obstetric and gynecology since 1993. Ma'am has done fellowship in maternal fetal medicine from Institute University of Barcelona, Spain. The subspecialty of ma'am is in maternal fetal medicine, and currently practicing in this field, which she has a passion for. Ma'am has a thesis about knowledge and practice of Jordanian obstetric and gynecology practitioners regarding ultrasonography. Ma'am is also organizer and a keynote speaker at many ultrasound and fetal medicine workshops in Jordan. Ma'am is also member of International Society of Ultrasound in Obstetric and Gynecology, that is ISU-OG, and active member and top winner in the fetus.net community as well. Recently, Dr. Dar Uday published an interesting case on the fetus.net community online regarding Elvis Van Creveld syndrome. So I am glad to have you, ma'am, on our Shield Connect page, and as well as Dr. Ritu Sanwani. I welcome you both on our web series.
Thank you, Nishant. So a very, very warm welcome to all of my dear friends who have joined all across the globe. So friends, as all of you are aware of, I am very passionate about the knowledge sharing. With this motto, I have done in the last year one series, the Pundit and Dr. Ritu Show, which has been recognized and appreciated all over the world. So now I have started the series, the Icons in Conversation with Dr. Ritu. So in this, every Thursday from 8 to 9 p.m. Indian Standard Time, I am inviting the stalwarts all across the globe on the different subjects. So I'm very fortunate that Dr. Umaya, in spite of having a very busy schedule, she accepted my invitation to be here. So a very, very warm welcome to you, Dr. Umaya. In our India, we say Namaste.
Thank you. Thank
Yeah.
you.
And I want to welcome you with these lovely roses. These lovely roses from
Thank you very much.
Greetings from India to you. So
Thank you
friends,
very much.
so today, without wasting time, now we are going towards the topic because madam is going to share with us a very, very important topic. Over to you, Dr. Maya.
Thank you very much, Dr. Ritu. And I thank you also for your kind invitation. And I thank the organizers and the attendees from all over the world. Thank you very much. I will share my screen now.
Yes.
Is it clear?
Very clear, very clear.
Okay, thank you. It is not the intention of this presentation to define clinical indications, specify appropriate timing of Doppler examination in pregnancy, or to discuss how to interpret findings or the use of Doppler in fetal echocardiography. The aim is to describe different modes of Doppler, which are commonly used to study the maternal fetal circulation and to minimize measurement errors and improve reproducibility. The outline of this talk, I will talk a little bit about history of Doppler, then the basic physics, the safety issues, and the different display modes of Doppler ultrasound. And at the end, I will talk a little bit about how to optimize the color Doppler. Christian Andreas Doppler was an Austrian mathematician and physicist. He is celebrated for his principle known as the Doppler effect, that the observed frequency of a wave depends on the relative speed of the source and the observer. He used this concept to explain the color of binary stars. And because his surname is Doppler, so it should always be written with capital D, Doppler in capital D. By looking at the change in frequency from the light which was coming from the stars, he could know the colors of the stars, and it is all about the change in light frequency. And what applies to light, it also applies to sound. So there should be movement between the source and the observer to have a frequency shift. Now, regarding the basic physics, I will not go deep into physics because I know every doctor and every physician hates this subject. The classical example you might remember from physics is the ambulance siren changing tone as it drives past you. This is because it changes frequency of sound waves relative to you as a stationary observer. The source and receiver are moving relative to each other. As you can see here on the right, the ambulance is moving toward the observer, so there will be higher frequency of the waves and the pitch will be heard louder and louder. While on the left here, as the ambulance is getting away or moving away from the observer, the frequency of the waves will become lower and the pitch will be heard at a lower tone. Now, this applies also to the movement or the blood flow of the red blood cells inside the vessels. And the human here between 20 and 20,000 hertz. And fortunately, the frequency shift is in this audible range. And this is why we hear the Doppler. If the red blood cell is stationary, as you can see here, it is not moving, there will be no frequency shift. And there will be no Doppler effect. While in the middle, if the red blood cell is moving toward the transducer, there will be a positive frequency shift. And on the other hand, if the red blood cell is moving away from the transducer, we will have negative Doppler shifts. Doppler will help us not only to assess the direction of the blood flow, but also the velocity as well. So we can see here, as the red blood cells are moving toward the transducer, it will be shown by increasing the frequency of the waves. And also, if the velocity of the red blood cells is increasing or they are becoming faster, the waveforms also will be more, and this will result in increased velocity. And this is very important to understand at the beginning. Now you can see here, as the blood vessel gets constricted, okay, what do you think that will happen to the velocity of the blood flow? You can see here, what we get here, this graph or the waveforms are because of the movement of red blood cells in this blood vessel. Now, if this blood vessel becomes constricted, what will happen is that the systole will become higher, and this is because the systole depends on the cardiac output, and the diastole will become lower. This is because the diastole depends on the peripheral resistance. And at the end result, we will have an increase in the pulsatility index, PI, if the blood vessel is constricted. And this is very important to understand regarding obstetric Doppler. So, as you notice, the reflected frequency or frequency shift is directly proportional to the speed with which the red blood cells are moving, or the blood flow velocity within that particular vessel. Now, the frequency shift of the retaining signal is displayed in a graphic form as a time-dependent plot. We have here two axes. The vertical one, which is the y-axis, we will plot here the velocity or the frequency shift. The velocity will be plotted in centimeters per second. And here the horizontal axis will show us the time or the cardiac cycle. So we will have systole, diastole, systole, diastole, systole, diastole, and so on. Now, there is an important thing to depend on, which is the angle of insonation. If the angle of insonation is 0, which means that the transducer waves are parallel to the blood flow inside the blood vessel, we will get the maximum Doppler shift or frequency shift. This is because, if you can see here, the frequency shift depends a lot on the cosine of the angle in the equation. So, and you may remember from the physics that cosine the 0 angle approaches 1, while the cosine 90 degrees approaches 0. So we should have an angle very near to 0 to have the maximum Doppler shift, and so to have the actual velocity plotted on the graph. And an insonation angle of 10 degrees, if this increases from 0 degree to 10 degrees, this will correspond to a 2% error in the velocity, while an angle of 20 degrees will correspond to a 6% error. So it is very important to take care of the angle of insonation during Doppler study. Now, as we said, the parallel sound beam, which means that the transducer is moving, or the waves are coming parallel to the blood flow inside the blood vessel, this will result in that the entire Doppler shift will be measured. And this means that the angle is 0, and we will measure the actual velocity inside this blood vessel. While if the sound beam is perpendicular to the direction of the flow, means that we have a 90 degree between the waves and the blood vessel, the measured velocity will be 0, because the cosine of 90 degrees is 0. So we should be careful to use as small an angle as possible. And this also tells us the same story. We have here at 180 degrees or at 0 degrees, we will have the maximum Doppler shift, and the actual velocity will be plotted on the graph. While if we have a 90 degrees, for example, or 270 degrees, we will have 0 Doppler shift, and we will not have any velocity detected. Now we have many indices to use in obstetrics. The most important of them are the PI, the pulsatility index, the RI, the resistance index, and the systolic diastolic ratio. And one of the most important also is the peak systolic velocity, which is very important because it is an angle dependent. It is largely an angle dependent. while the PI is not an angle dependent. We should take care about this. And the peak systolic velocity, when we are studying the fetal anemia and studying the peak systolic velocity of the middle cerebral artery, we should be careful to have an angle of 0 to have the actual velocity inside the middle cerebral artery. Now, applying this to ultrasound, if you can see here the color map on the top, and the color map will show us the direction of the blood flow and also the velocity inside the blood flow. Now, if the blood flow is going toward the transducer, this will be colored, the blood vessel will be colored in red, and the waveforms will appear above the baseline. While if the blood flow is going away from the transducer, it will be colored in blue, and the waveforms will be plotted on the other side or the lower side of the baseline. And this is very important to understand. This is the same thing. You can have here the color map, and to demonstrate more, the color map shows us the colors and also the velocities. You can see here that the blood flow which is going toward the probe or the transducer will be colored red, and if it is more faster, we will have the more brighter color, which is the yellow. While if the blood flow is going away from the transducer, we will have the blue color, and with faster velocity, we'll have the more brighter color, which is the green. You can notice here at the middle, it is black. Why it is black? Because at this angle, you can see here, the transducer has an angle of 90 degrees with the blood flow. It doesn't mean that we don't have any velocity here or the blood is not moving. It means that the machine or the ultrasound machine cannot detect any blood flow here because the cosine 90 is 0. This is the same, the velocity, which is in centimeters per second, or the frequency shift, which is in hertz, is plotted against the time of the cardiac cycle. And the appropriate waveform should be, or the ideal waveform should occupy 2/3 of the screen. Now, when we have this waveform, what we see here is the spectrum of velocities of all the red blood cells which are moving inside the blood vessel. So in the middle of the blood vessel, we will have the fastest red blood cells, and the velocity will be showed here. And at the wall of the blood vessel, because there is a friction between the moving red blood cells and the wall of the blood vessel, we will have the least velocities or the slowest velocities, which are detected here. So under this graph, we'll have a spectrum of velocities from the slowest to the fastest. Now, regarding the safety issues, if we talk about Doppler, we should speak about the safety issues, especially in the first trimester of pregnancy. As you may know, the heating potential and the power of energy which is applied on the fetus will move from the lower potential at the B mode or 2D and 3D until the highest heating potential with the pulse Doppler. You can see here it goes from down to up. And the pulse Doppler will have the highest power and the highest heating potential of the fetus. The color Doppler is less, the M mode is less, and the safest, of course, is the B mode. And this is an updated statement from the ICUG regarding the use of Doppler in the first trimester during the embryonic and the fetal life. During the embryonic life, all different modes of Doppler should not be used routinely. And if the use of Doppler is clinically indicated, then the exposure time should be kept to a minimum. While during the fetal period, which extends from 11 weeks until the 13 weeks plus 6 days, the different modes of Doppler may be used routinely for certain clinical indications, such as screening for trisomies and cardiac anomalies. But the displayed, we should keep an eye on the displayed thermal index, which is the TI, which should be below 1, and the exposure time should be kept as short as possible, usually no longer than 5 to 10 minutes. And if you want to ask about the uterine artery Doppler during the first trimester, there is no constrictions or there is no constriction to use you can save it very safe in the first trimester because it is away from the fetus. Now I will come to the display mode of Doppler ultrasound. We have actually different display modes. We have the color Doppler, the power Doppler, spectral, continuous, tissue Doppler, and duplex Doppler. The obstetrician is concerned about most of these, but what doesn't or is not important too much to us is the continuous wave Doppler, which is used for the fast blood flows for the adult, for example, during the examination of echocardiography. Now, the color flow Doppler, conventionally, the flow towards the ultrasound transducer, as we said before, is displayed in red, and the waveforms are above the baseline, and the other way around, when the blood flow is going away from the transducer, it will be displayed in blue and on the down side of the baseline. And the black, as you can see, the black means that there is no velocity shift at this area. Now, what the color box means, the color Doppler box measures the velocity of all the red blood cells inside this color box. So we'll have multiple sample volumes. However, if you can see here with the pulse Doppler, the pulse gate, it will show only or will measure only the velocities of red blood cells which are inside this gate only. It will not measure only the blood flow which is going through this gate, but not outside this gate. And the color Doppler imaging is very important to identify the vessels of interest, to identify the presence of flow and the direction of flow. And we should have always a correct angle of inclination for velocity measurements. Here are some examples of color Doppler to see, for example, the aortic arch, the 4-chamber view, and 3-vessel view. And using large color box will decrease the frame rate. So we should try to use a small color box as possible. And color Doppler resolution increases when the color box is reduced in size. And care must be taken in assessing the mechanical index and the thermal index as they change according to the size and depth of the color box. Increasing the size of the color box also increases the processing time and thus reduces the frame rate. The box should be kept as small as possible to include only the studied areas, as you can see here in the different examples. And this is an example of the importance of the color Doppler when to detect, for example, a muscular ventricular septal defect with a bidirectional flow, as you can see here in the clip. Now, regarding the power Doppler is very sensitive and it images the slow flows, small vessel lumina, and parenchymal perfusion. The angle of insolation here has less effect on the power Doppler than it does on color Doppler signals. And we use it only to detect if there is a blood flow or no. And in the recent machines, ultrasound machines, the power Doppler also became directional. So you can see it, you can know the direction of the blood flow as with the color Doppler. Here are some examples also of the use of power Doppler. You can use them to detect, for example, the pulmonary veins, the internal mammary arteries, the pericallosal artery, and vein of Gallen. And as you know, it is very important to detect or to study to visualize the pulmonary veins to rule out total and partial anomalous pulmonary venous return. And you can see here in this clip, the 4 pulmonary veins, very obvious. Now, the pulse Doppler wave or pulse wave Doppler it means that the transducer has one crystal which sends pulses to of ultrasound waves to a specific point. Then it will listen for reflections. So we will have an obligatory built-in pause to listen for reflected signals. And we use the sample gate here, or sample volume, which should be, its size should be about 1/3 of the diameter of the blood vessel, and it should be centered or positioned at the center of the vessel lumen. And we said before that this is very important because we want to study or to measure the highest velocities of blood flow, which is in the center of the blood vessel. And we will have a graph here plotting the velocities against the cardiac cycle. Here are some examples of the pulse Doppler. You can see here to study the atrioventricular valves, the outlet tracts, and the pulmonary and veins and arteries simultaneously. The continuous wave Doppler, it has actually, the transducer has two crystals which sends and receives simultaneously the pulses. And an example of this is the cardiotocography, which is the CTG, which we use it in the labor room. Here is the same, it has two crystals, as you see here. And this is the difference between the pulse Doppler and the continuous Doppler, the pulse Doppler has only one crystal, while the continuous Doppler has two crystals. Now, coming to the tissue Doppler imaging, this is a variation of pulsed wave Doppler. But what is the difference? It is designed to evaluate high amplitude, low velocity signals from myocardial motion. So our concern here is not the blood flow inside the blood vessels or inside the four chambers, for example, but our concern is about the cardiac function and the movement of the cardiac muscle. So this Doppler will filter the high velocities, and it will only detect or measures the low velocities, as you can see here, which is about 10 centimeters per second, which is of the contraction of the cardiac muscle. This is the same. This is the conventional Doppler, which measures the flow or the velocity of the blood flow, while the tissue Doppler, it measures the velocity of the contractility of the cardiac muscle. Now coming to the last part of our talk, which will be about how to optimize the color Doppler. To know how to optimize the color Doppler, we should know about the function of each knob on our ultrasound machine. We should know a little bit about knobology. The most important thing or knob which I really consider as very important is the pulse repetition frequency. The pulse repetition frequency, or PRF, it is the pulsed wave Doppler has to send and then wait to receive a signal before emitting another pulse. So you can hear that you can see here that the machine is sending pulses, okay, and then there will be a listening time, and then it will send another wave of pulses again. This period from the sending the pulse duration plus the listening time, this is called the pulse repetition frequency. And the pulse repetition frequency or scale is the frequency at which the ultrasound signal pulses are emitted. And a low PRF allows signals from low moving targets to reach the transducer before the next pulse is emitted. Whereas a high PRF will allow only the high velocities to reach the ultrasound transducer before the next pulse. And there's something important. So, many of the doctors think that color gain, for example, or any other knob is responsible for aliasing. You should remember always that what is important for aliasing, or what is responsible for aliasing, is the PRF and nothing else. Now, when you are looking at the wheels of a fast car, you will have false impression that it is moving backward. And this is because our eyes do not see by the same frequency like the moving wheels. And the PRF should be at least twice the velocity inside the blood vessel to be able to detect all the velocities of the blood flow. Otherwise, we will not get the whole velocities, and we will have what is called aliasing, as we can see later. This what I mean by aliasing. Aliasing, when we have here in color Doppler, it means that we will have multicolored signal. So instead of pure red or pure blue, we will have multicolored signal here. So we will have aliasing here because we used low PRF. And if we use it with the pulse Doppler, what will happen is that the high velocities of the blood vessel will not be detected. They will come and wrap around from down and get to appear from below the baseline. So what is the solution to this problem, to aliasing? The solution is either we lower the baseline to make it lower, or to increase the PRF to include or to be at least twice the velocity, the maximum velocity of the blood vessel. So the velocity in the blood vessel should be not more than half the PRF. And because of that, we should know a little bit also about the velocities inside different blood vessels. In general, to measure the high velocities in the arteries mostly, we should increase the PRF, and to measure the low velocities, and this is venous mainly, and we should use a low PRF. Now, this is a very important example also on the PRF in the color Doppler. You can see here the color map. What will happen here if we use a low PRF? If we use a low PRF, you can see here that we got the red and blue color. Why we got these two colors? This is because the machine measured all the velocities except the high velocities. So the high velocities will go up, up, up until they reach here, and they don't find more velocity to be covered by. So they will go down and wrap around this color box to get from the blue color. So what will happen here is that we'll have aliasing, which means that we have multicolored signal. See here what happens if we increase the PRF, we'll get the same color, and the blood vessel will be all shown. And if we increase the PRF more and more, we will not see the low velocities which are near the blood vessel wall. Here is also another example of PRF. If we use a high PRF, we'll have the aliasing or wrap around effect. And if we increase the PRF, we will get all the wave form appearing above the baseline. We should be careful because PRF always has an inverse relationship with the depth of sampling. So in patients with high BMI, we should use a lower PRF than usual. Now, regarding the color gain is not responsible at all for aliasing. The color gain, if we increase it, we will have something called bleeding artifact, as you can see here. So we will have multicolored signals in areas which does not have, from the parenchyma, they do not have a blood vessel there. And if we have the optimum blood color gain, we will have all the vessel will be filled. And if we low color gain, the blood vessel will not be filled properly. So how to adjust the color gain? If we have this picture and we have so many bleeding artifacts, we will start to decrease our gain until we get only the blood vessels delineated by color and not the rest of the parenchyma. Same here, the color gain is responsible for a false impression of a high peak systolic velocity. So here with bleeding artifact and high color gain, we'll have a wrong peak systolic velocity, high. And so if we decrease it very much, we'll have wrong insufficient gain and wrong low velocity. And with the proper gain, we will have a peak systolic velocity, which is the actual velocity. Now, coming to balance, the balance sets how much the color Doppler should paint over the grayscale. And to understand this, we can see this slide here. If we use high balance, we cannot see the interventricular septum. And actually, there is no blood flow through the interventricular septum, but here we cannot see the interventricular septum. If we lower the balance a little bit, we can see the proper flow inside the chambers, and also we can see very clear the interventricular septum. And if we decrease the balance more and more, we will not be able to fill the chambers properly with color. In general, if we want to, for example, to check for VSD or ventricular septal defect, we use low balance. And for example, for apparent right subclavian artery, we should use high balance. And for the blood vessels, which are seen usually on the gray scale, you should use low or mid balance. Like, for example, the three vessel view, or the pulmonary and aorta, you can see them on gray scale. And for the blood vessels, which are difficult to see on gray scale, you should use high balance to be able to see them properly. And we said before that the sample volume should be adjusted not to be big too much, because this will result in contamination. Now, the sweep speed is very important. The sweep speed, it should be enough to separate successive waveforms. And it differs according to the indication. So if we want to have the details or greater details about the individual waveform, as for example here, this is the uterine artery, we want to see, for example, if there is a notch, how is the diastolic flow and so on, we should use high sweep speed. While if we want to see the variation in the waveforms, like for example, in 20/20 transfusion syndrome, to detect if there is bidirectional arterial anastomosis, we should use low sweep speed or slow sweep speed to be able to detect the varieties in the waveforms. And ideally, the screen should contain or display about 4 to 6, but not more than 8 to 10 complete cardiac cycles or waves. Regarding the filter, in general, the filter will, if we use low filter, for example, with the umbilical artery, we can see all the velocities, the high and the low velocities. While if we increase the filter and we have a higher filter here, the diastolic velocities or the low velocities will not be seen, and it will appear here as if there is no diastolic flow. So it's better to use a low filter with these blood vessels. Now, regarding the filter, this is the same also. If we use high filter, we will not detect the low velocities. And if we use high filter, if we lower the filter, we will get all the velocities. So take home messages. Sorry. Actually, I have recovered from COVID-19 very recently.
You can take some water, ma'am.
Thank you.
Yeah.
So the Doppler effect is found in waves where the source and receiver are moving relative to each other. So there should be a movement between the observer and the receiver. The pulsed wave Doppler and color flow Doppler are the most frequently used techniques. Doppler techniques make the non-invasive assessment of fetal hemodynamics possible. The umbilical artery Doppler should not be used as a screening tool in healthy pregnancies, as it has not been shown to be of value in this group. And I advise my colleagues not to use or to study the umbilical artery Doppler in every pregnancy, because this will lead to unnecessary interventions. Equipment should have color flow and spectral wave Doppler capabilities with on-screen display of flow velocity scales or pulse repetition frequency PRF and Doppler ultrasound frequency in megahertz. So if anybody is thinking about buying a new machine, I advise to be included the color or the all different modes of Doppler. Since inaccurate information concerning fetal Doppler studies could lead to inappropriate clinical decisions, it is imperative that measurements be undertaken and interpreted by expert operators who are knowledgeable about the significance of Doppler changes and management techniques. And thank you very much.
Thank you so much, Dr. Omaya, for such a wonderful presentation.
Thank you.
You can also see the chat box is full of appraisals.
Okay.
Yeah. Some messages I have got that some doctors have missed the initial conversation. So friends, I have already put the link of my YouTube channel. The program has gone live on the YouTube. So those who have missed can go through on this YouTube channel and can see the program. Now we are open for the questions. Yeah. Yeah. There are some questions we have received. Lot of appreciations we are getting, Dr. Omaya. Yeah.
Okay. Thank you.
Thank you so much. I'm just taking the questions. Yeah. Let's see. Friends, besides that, I have put my WhatsApp number in the chat box. So those who want to be a part of the academic group, please send me the WhatsApp message on that number with your name and workplace. So I am able to add you in the academic groups. Please don't put your details here. Please send me on that number. Yeah. Dr. Omaya, you can see there are some questions we have received. One is from, yeah. Just a second.
There is a question here about what about steering? I don't understand. Could Dr. Muhammad Yusuf tell us what you mean by steering?
Dr. Nishan, can you please help me for the questions?
Yes, Dr. Mohammad Yusuf is asking, please describe the importance of the steering.
What does he mean by steering? We are not getting.
Box steering.
Okay.
Linear probe.
Linear probe.
Yes.
Well, I don't understand the question, but we use the color box to be only to show the blood vessel we are studying only. Should not be large, because the large will result in it will decrease the frame, and this will give us we will not be able to study the waveform well. So we should have usually we don't use the linear probes in obstetrics. We use the convex probe, but I don't understand what is about the linear probe actually. But usually we should use a box which is appropriate, the size of the box appropriate to the vessel we are studying. How can Doppler study helpful in detecting fetal jeopardy? Can I? Yes. In different ways. This lecture or this presentation was to optimize your color flow, not to study, for example, the IUGR or high-risk pregnancy. I hope later on we can do a talk about this regarding the high-risk pregnancies, or how to predict the high-risk group to be able to manage them appropriately. What is meant of color balancing? Yes, the balance, color Doppler balance, it means that you are, as if you are painting a wall. If you paint the first layer, you will still see the underneath of this, the original color of the wall. This is a simple explanation. If you put another layer of the new color, you will conceal or hide the previous color. This is a way to understand it in a simple way. So if we have a high balance, we will not be able to see the interventricular septum, for example. And in general, if you can see the blood vessel on a gray scale, it is a large vessel and it's very obvious, you will use low balance. And with small, very small blood vessels, like for example, the pulmonary veins, you use high balance to be able to visualize them appropriately. Ductus venosus Doppler, your kind recommendation. Well, I told you before, this is not a talk about the blood vessels and so on, but in general, ductus venosus in the first trimester, we try to use the sagittal plane, and we use the velocity of this vessel is usually high. It is about 50 to 70 centimeters per second. So we should use a high PRF. And in the second trimester, we can use the oblique axial plane to get it. When you see a liaising between the umbilical vein and the inferior vena cava, this is why we see liaising. We see liaising because the velocity is very high inside the ductus venosus. And when you see liaising, you apply the pulse Doppler and you will get the waveform, which contains the systole, diastole, and the atrial contraction. What is the significance of middle cerebral artery Doppler ultrasound? It is very important because in two ways. First of all, during this is not the scope of our talk, but if the time allows me, I can explain, Dr. Ritu. What do you think?
Yes, you can explain, ma'am. We all are enlightened by your knowledge, so everyone wants to learn more and more.
Thank you very much. Now, if we are following a fetus with intrauterine growth restriction, so we will have sometimes the umbilical artery Doppler will not change, but the middle cerebral artery will show something called redistribution, and the diastole will start to increase. So the PI, or the pulsatility index, will be lower than normal. This means that this fetus is maybe in jeopardy. The second thing, we can use it to detect anemia in the fetus due to any reason. If the peak systolic velocity becomes more than 1.5 multiple of median from the ordinary measurement, this means that this fetus is anemic and it might need blood transfusion. So we use the peak systolic velocity and the PI also. What about the sample gate pulse wave? What is the recommended size? Yes, the recommended size to use a sample wave sample gate to be about 1/3 of the diameter of the blood vessel at least, and not to be very large, because if you use it very large, especially with the ductus venosus, you will have contamination from the nearby vessels, okay? And it is best to be placed in the center of the blood vessel to detect the highest velocities of the red blood cells and not the low velocities near the wall. For a new machine, how much frame rate and probe frequency for an obstetrician? It depends upon the need of any obstetrician. And if he uses vaginal, because the vaginal will have higher frequency and so on. What knobs are used for balancing? There is a knob on the machine. It is written on it, balance. You can see it. And the same thing for PRF and for color gain and so on. Every function of this has its knob. So in IUGR, better to use middle cerebral artery. I didn't say that because it is out of scope of our lecture, but in IUGR, the PCR ratio, which is the placental cerebral ratio, or cerebral placenta ratio starts to change before the umbilical artery changes. And this is especially in the late intrauterine growth restriction, not in the early intrauterine growth restriction. How color Doppler imaging is helpful in differentiating a tumor.
I think we can take some separate lecture for that. That is again
Yes,
a very
yes.
big topic.
My lecture mainly was how to optimize.
Yeah.
You know, it is very important to optimize your color Doppler and then to start to apply it for a clinical application.
Yes, 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 yeah. So still a lot of questions are coming. Dr. Omaya, I need your digital signature. I will collect from you because a lot of doctors are asking for the certificate of attendance. So,
Thank you. I will, inshallah.
Thank you so much.
Thank you very much. Thank you to everybody, for the attendees, for the organizers, and mainly for you, Dr. Ritu. You are very active, and thank you very much for your kind invitation.
Thank you so much. Before I wind up, because my show name is the Icons and Conversation with Dr. Ritu. So now we have finished the academic things. Now I will ask you some non-academic things with your permission. So Dr. Omaya, what motivated you to become a doctor? Is it your dream to become a doctor from the childhood?
No, it was not, never, it wasn't at all. Yes.
Okay.
It was my father, Allah yarhamu, my father's dream, yes.
Okay.
But if you want to know, the fetal medicine is my passion, really.
Okay.
As many other doctors, I can see that many other doctors are interested in this field, which is very, very interesting field, actually.
Okay. Thank you. Thank you so much. Still a lot of appreciations we are getting. So now once this corona will be little settled down, we want to welcome you in India and to gain more and more knowledge from you.
It is my pleasure. Thank you very much. Thank you, Dr. Ritu. Thank you, everybody. Thank you.
Thank you. Thank you. So friends, with this we wind up the today's session, and in advance, happy Diwali to all of you. Diwali is the festival of lights. So in the next week, we are not meeting on Thursday, but we are meeting on the Friday with the same show, the Icons and Conversation with Dr. Ritu, same time, 8 p.m. I am having another faculty all the way from the Greece with a very interesting session. So please do join us on next Friday at same 8 to 9 p.m. Besides this, tomorrow I'm having one more session at 8 p.m. Those who are interested are most welcome to join. Tomorrow I will be speaking on the role of the carbetocin in the management of BPH. And before I wind up, big thanks to Shield Connect team and special thanks to Dr. Nishant and Dr. Prachi.
Thank you, ma'am. Thank you so much.
Yeah. So with this, we wind up, friends. Dr. Fatima wants to say something. Yeah, Dr. Fatima, can we unmute her? Dr. Nishant?
1 minute.
I have seen my some friends have joined Bhutan also. So very warm welcome to them also.
Dr. Fatima, you can unmute yourself. Yes, we can hear you.
No, I think by mistake, it looks like that. Yeah. So friends, some of you have sent me the WhatsApp. Again, I'm repeating, those who want to become a part of that group, please send me the WhatsApp messages with your name and your workplace. So all are welcome to join for the academic discussion. So once again, thank you very much, Dr. Omaya, from the bottom of my heart.
Thank you very much. Thank you.
Thank you, Dr. Omaya. Bye.
Thank you, everybody. Thank you. Thank you very much.
Yeah.
Happy Diwali.
Yeah. So Nishant, we will wind up now. Yeah.
Yes.
Okay.
Okay.
And thank you to Chitra also, our technical staff.
Yes.
How can I forget the Chitra? Without Chitra, nothing is possible. Chitra, thank you so much, dear.
Thank you, ma'am. Thank you so much, ma'am.
Okay, dear. Bye-bye.
Bye, everyone.
Bye. Bye.
Bye.